I debuted the third generation LacriPen at the OAS meeting in November late last year, where we were able to show you that our osmometer is able to detect tear film osmolarity with a sensitivity approaching 2 milliosmoles. However, my talk today is not about osmolarity with the LacriPen. It's to say that the LacriPen is actually far much more than a tear osmometer. In fact, we've been able to develop a lot of chemistries and biochemistries on the surface of our LacriPen so we can determine MMP9 and other types of disorders such as adenovirus and MRSA. I'm also going to talk about today about the platform technology we've developed in the fact that we have developed a universal platform where we can put any antibody on the surface and potentially detect any type of ocular disorder or antigen. I'm going to talk briefly about the clinical testing at our 2 locations with IRB, as well as our continued bench testing and the new data handling algorithms that we've been developing. The LacriPen is a pretty small device. It's about 6 inches long, and it's a portable diagnostic device that runs on a battery. It uses a very sensitive technology called surface plasmon resonance. Now, as a community for 30 years, we've all been using surface plasmon resonance, and these devices are pretty large, as you see in the left top-hand corner here. They're about the size of washing machines. They cost about $100,000. We've been able at LacriScience to take that pretty advanced technology and condense it down into something very small, yet, and importantly, maintaining the very good utility and sensitivity of the SPR technique. At the heart of the LacriPen is our disposable prism you see at the bottom. This is the disposable part of the LacriPen, and we put our biochemistries on the surface, on the gold surface of that prism to detect particular different ophthalmic antigens. Since I spoke to you last in OIS Chicago, we've been looking at our manufacturing prism-to-prism reproducibility, and we have pretty good reproducibility. We've been looking at the linear responses of our pen to different solutions, and you see here a ratiometric, pretty linear response of our pen. And we've been looking at our pen-to-pen manufacturing reproducibility. Today, LacriScience has 5 working prototypes. And if anyone's interested in a demonstration, we have several prototypes, including this one, that we're able to demo for you today. What is also interesting is that the LacriPen uses 2 wavelengths in its measurement. It uses an 855 and a 950 wavelengths in the near IR. These low-power LEDs that we use them because they have great penetration depth into tear films because the evanescent field at these wavelengths is desirable. But what's interesting is that we can ratio these SPR responses. We can divide the 855 by the 950 wavelength response, and when we do that, we actually correct for the prism-to-prisms manufacturing variations. We also correct for LED intensity drifts over time and between pens, and we can also correct by taking this ratiometric approach for other type of manufacturing artifacts that occur during that manufacturing process. What I want to highlight today is that LacriScience has developed an MMP9 disposable prism for the top of the LacriPen. We have been able to develop a MMP9 sensor that has a dynamic range of about 1 to 200 nanograms per milliliter. The LacriPen is a quantitative diagnostic device, so we can determine pretty accurately what the degree of MMP9 is in a tear film with a precision of about 5 nanogram per milliliter. There's no other device today that can do this that we know about. On the bottom of the slide here, you actually see some of our data that's actually taken from the LacriPen. These measurements are very rapid, within a few seconds, and we get the typical Olgaev Langmuir binding isotherm curve that one expects to see from an antigen-antibody binding. Probably of equal importance to the development of the MMP9 is that we've also been able to develop what we call a universal platform of the LacriPen. We've been able to develop universal biochemistries that when we put them on the pen, it's very easy for us to put other different biochemistries and antibodies on the surface. This is reducing our cost and reducing our development time as we move into the development of other sensors such as MRSA, adenovirus, herpes simplex, etc. What is also interesting is that we have a tunable dynamic sensing range. What do I mean by that? Well, we all know that the clinical significance of MMP9 in our eye is in the nanogram per milliliter range. But if you wanted to measure, say, lysozyme or tryptase, those concentrations are much, much higher. By putting the antibodies and the biochemistries down on the surface of these gold films at different densities, we're able to tune this dynamic range. As I mentioned, we now have an MMP9 and as well as a tear osmometer for the LacriPen, and we're moving into adenovirus, tryptase, and into other ocular conditions. An update on our clinical testing. LacriPen currently has a dual path. We are both looking at osmolarity in tandem of developing these smart diagnostics, such as MMP9 adenovirus. We had our IRB approved on February the 17th for a 15-patient study, and work was just recently completed on April 19th, just a few weeks ago. And this work has been done at the Virginia Eye Consultants. As I move to my next slide, I'm actually going to give you a demonstration of how the LacriPen works on a very small movie. This movie only lasts a few seconds, and it just shows you how rapid the LacriPen is. Literally, the pen comes up to the eye, it touches the eye, and you get an instantaneous measurement, whether it be for tear osmolarity or whether it be for MMP9 or some other ocular disorder. Here's an example of the LacriPen in use. The LacriPen comes in, it touches the eye, and we get an instantaneous measurement. Thank you for your attention.